Good morning, this is Dr. Reese again with Reese Dental at Lake Country, and today we're going to talk about what is called non-surgical gum treatment and why it might be necessary. Now, the World Health Organization has identified the fact that over 90% of American adults have some sort of gum disease, whether it be mild gingivitis, which is basically irritation and swelling of the gums, all the way up to the severity of loose teeth and teeth that are falling out because of gum abscesses and them not taking care of their teeth or not knowing how to or not having the resources to take care of them. It is very common nowadays for dentists to be much more aware of the need for early involvement in treating gum-related problems. Gum-related problems can cause systemic health problems. Certainly they've been related to heart attack, stroke, pneumonia, low weight term babies. Many things occur in the body simply due to the bacteria and the things that are in the mouth. Now, the most common treatment that you will hear mentioned is what's called deep cleaning or scaling and root planing. And many times we get patients that come in and they don't understand the terminology, and they have an insurance policy that says, okay, we will pay for 2 prophies a year, and another name for prophy is a cleaning. Prophy means prophylaxis, preventing you from getting gum disease, and that's what a cleaning is for. But a true scaling and root planing or deep cleaning is much more than a prophy and is not covered at 100% by most dental insurance companies. And so the symptoms of a person that might need scaling and root planing is that they would have red bleeding gums, usually a putrid odor or smell to their breath. Maybe they wake up with blood on their pillow, or they bleed a lot as they brush their teeth. They're unable to floss their teeth or floss in between their teeth because of the amount of tartar that builds up. And that gets down to what is the cause of it, and the cause is primarily inadequate oral hygiene. Brushing alone is not enough. When you brush your teeth and you're doing the very best job that you possibly can, the very best you can do is clean just a little over half of the tooth surface, because the tooth surfaces that remain in between the teeth are not able to be cleaned by a toothbrush, and they must be cleaned either by a special brush called an interproximal brush, if you have spaces where you can brush in between the teeth, or by flossing. Flossing, for whatever reasons, seems to be difficult for people to, number one, to accomplish properly, but number two, to incorporate it into their daily routine so that it's not a hard or a difficult thing to do. People will not perform procedures for you, particularly cleaning their teeth and whatever and flossing them, if it's difficult for them to do. Anyway, the scaling and root planing or the deep cleaning generally involves numbing up the gum tissue and the teeth, as the teeth will many times be sensitive as the roots are cleaned and planed. And then the most important thing after a deep cleaning is what the patient does at home to keep those surfaces clean once the hygienist or the dentist has removed the excessive buildup. It becomes then a home treatment or a home regimen of keeping them clean that will keep your teeth healthy. Thank you.